today they are trying to open the best of the best diagnostic centers in the state of Telangana. I really appreciate for doing these kind of things in Telangana. It is because the diagnostic centers are the most important centers where people can go there and diagnose and prevent their diseases. And I personally appreciate Dr. Prasad Reddy Garu. Way back, few decades back, he started Maxivision with a state-of-art, the eye hospital in Hyderabad when there was no laser kind of an operation for eye operation. So that day, when they started, it was a big thing. Though now it might have come many centers, but it was a very big thing those days. And whatever the knowledge he acquired, he tried his level best to give it to the society through his knowledge. And at the same time, on the same line, Dr. Suryanarayan Garu, while he is speaking that he has told us that he started this center along with his friends, benchmates, and now passing on to his next generation. That shows how credibility and integrity, even doing their business for decades together, still they are maintaining the same kind of old friendship with the benchmates. Something it is it is something definitely abnormal where we are not able to find these days. And GSK Velu Garu, his new bike centers are very popularly known in Tamil Nadu. Has told that he has a center even in Dubai also. So all the renowned people coming together with their best of their capabilities and ability and knowledge, bringing together and starting these centers, definitely I feel will give a best diagnostics and healthcare facilities to the people of Telangana. It gives me a great pleasure to be here today, to be part of an initiative that speaks not just to growth, but to care, not just to infrastructure, but to trust. Healthcare is one of those sectors where success is rarely visible. If diagnostics work well, nothing dramatic happens. No headlines, no emergencies, but when diagnostics fail, everything else collapses. So this is where the diagnostic centers are very, very important. Today's event may appear modest, new laboratories, new centers, but in reality this is about strengthening the first line of defense in public health. When Telangana entered a new phase in December 2023, the mandate before the new government was very clear. The people were not asking for spectacles, they are asking for assurance. That assurance we are trying to give to our best of ability to the people of Telangana. Assurance that governance would return to the first principles, that the everyday concerns of ordinary families, health, education, livelihood, would once again occupy the center of public policy. This government came in with a conscious decision to place public health back in focus, not as a peripheral subject, but as a foundational one. Because without health, there can be no dignity. Without dignity, no real development. This is what this government believes. In that sense, initiatives like today's are not isolated events. They are part of a broader shift towards prevention, access, and equity in healthcare, especially beyond our major cities.